Hi, this is Dr. Ashley from Peak Performance Chiropractic, located in Pflugerville, Texas. Today we're going to be talking about an issue that for many people is a very serious and debilitating issue, and that issue is migraines. All right. The reason why I say it's debilitating is because I can't tell you the number of patients that I've had who've come through the doors who they're missing out on life. Right. They're not able to play with the kids the way they want to. They're not able to exercise the way they want to. They're having to miss work, 1 to 2 days a month, or even sometimes a week, because of the severity of their migraines. Many of them have gone to every doctor under the sun, whether it's the neurologist, the endocrinologist, obviously your general practitioner, and many times they're just not getting the results that they need, and so they call our office and they're just wanting help, and they're trying to do something a little bit different. Okay, and one of the reasons why I think we get such good results here in our clinic is the approach that we take. All right, the approach that we take is very thorough, and it's very investigative as far as trying to figure out exactly what's causing your particular migraine. All right, so the first thing I always look at is, as a chiropractor, obviously, I'm always going to start with the spine, right? So number one, I want you to understand that the first thing that I'm looking at is what does the spine look like? Now, your spine should be shaped like a banana, like you see here. So the cervical spine should look like a banana. Now, that there helps to allow for proper movement as well as proper weight bearing. In addition to this, your spinal cord actually forms down the spine exactly like this. So what we see a lot of times in our office is when people come in and they're experiencing migraines and things, they're going to have a spine that looks something a little more like this. So do you notice how that spine went from being shaped like a banana to being very straight, right? Now, many times I'll have people, when we're able to look at their spines and see exactly what's going on, they'll look and they'll say, "Doc, I have a straight spine. Isn't that a good thing?" Well, when you're looking from this angle here, yes. When you're looking from that side, unfortunately, it's not, right? I want to take you through an exercise, and I want you to do it with me to see if you think that this would be beneficial for you. So here's where you are. This is your head. This is your neck, right? If your neck has straightened out, this is the weight of your head here. Do you feel the weight do you feel the weight there, and do you feel the punishment that's being taken to those knuckle joints, right? Now, I want you to do me a favor. We're going to take here, remember that curve we talked about? We're going to put a curve in there. Now, do you feel the difference in there on those joints? I hope that you do, right? Now, it was easier on those joints when you had that curve in there versus when your neck was straight like that, all right? And so if we have that constant pounding, then we know that there's going to be some issues that will continue to progress, right? That's not something that stays that way forever. It is something that actually will progress and eventually get worse, all right? And so we want to look and see, number one, what does your spine look like? Now, because migraines, like pretty much every other disease out there, there is not a single factor that causes migraines by themselves, right? There's also muscular involvement. So we'll check out the muscles, see what the muscles are doing. Nerves. How is this affecting the nerves that come from the spine, right? So you have these nerves that come from the spine and go down. Sometimes people with migraines also have neuropathies or things, paresthesias, things where you may feel numb, tingling down the arms, pain down the arms, even things like carpal tunnel, all of that as well. Okay, can be a neck issue, can be due to the nerves that come from the neck. All right, as well. Nutrition. We may need to look at your nutrition. See, are you eating something or not? Not doing something as far as that's going to get you where you need to be, or something that's going to be basically invoking the migraine. Something's going to be causing you to have the migraines because of the food you're eating. How about exercise or lack thereof, right? So we want to look at your exercise habits, see, are your exercise habits attributing to your migraines, right? Another thing that we look at is we look at oxygenation. We want to see, are you getting good oxygen to your brain? If we can get good oxygen to your brain, many times with migraines, what we're going to have decreased oxygen that's causing the migraine to come on. So we want to make sure we're getting good oxygen to your brain. All right. As well, what we do in our office is we also look at brain balance. So we're going to look at the different hemispheres of the brain, the different parts of the brain, see if there are deficiencies. If there are deficiencies, those are things many times that can be corrected. And so we want to try to correct those in as natural way possible, whether it's through adjustments or very easy home exercises, those kinds of things. All right. And then lastly, of course, we want to look at posture. We want to see if your posture is playing a role and that kind of thing too. So there are many different factors to migraines. If migraines are something you struggle with and migraines are something that you'd love to get checked out, I can tell you I'd love the opportunity to sit down with you to figure out exactly what's going on with you and exactly what's going on with your migraines, and if there's any way that we can help you to get your life back. I hope this information has been helpful to you. Again, if you have any questions, please don't hesitate to call our office. Thanks for watching and have a blessed day.